Hello, thank you for your invitation. I'm very pleased to be with you on this very special event for you, the 25 years of the CMTC OVM. It turns out that it's also the 25 years of Eurordis. So I would like to take this occasion together to look back at our achievements and try to look at where we need to go. In particular, throughout the years, you have helped hundreds of patients from over the world to receive medical diagnosis. As a patient organization, you have also succeeded to bring patients and their families together by means of the International Family Days and Members Conference. Thanks to your series of booklets after the diagnosis, parent support and guide, as well as the multitude of resources on your great website, which have been translated in multiple languages, you've provided support to all those who have otherwise been left on their own or left behind. And the impact of this communication goes far beyond Europe. We're very much in a similar situation here. The fact that we communicate in different languages and in a way which is empowering for patient advocates and their families in Europe, but also beyond. This year, I understand that you will be providing trainings in the Netherlands for patient advocates from around the globe. And I really praise your efforts for that. And I know you're collaborating with Rare Disease International, and I hope you will engage also in this dimension of capacity building. I also understand that you're launching an initiative which I love, the special website for young advocates to empower them and make them better advocates. However, major challenges remain, and they are true for you and they are true for rare disease at large. Fast, accurate, reliable diagnosis is still the key and a key objective for us. We want to reduce the time from 4 to 5 years on average in Europe to 6 months within a decade. Research, basic research, understanding the pathway of some of the rare diseases, and in particular, in your case, finding the genetic causes of vascular malformations, if any. Maybe there is other causes that research will bring you. The limited financial resources, which is a struggle for all our patient advocacy group, but also engaging the young patients who will lead our movement and our movement of rare disease at large for the next generation. Cross-border healthcare remains a major challenge, I understand, for you, but I have to say, for all rare diseases. We just submitted recently, within the consultation of the European Commission on the Cross-border Healthcare Directive, it's clearly a disaster, it's not functioning, and this is what we're telling them on your behalf. It's too much bureaucratic, there is too much understanding by the public health insurance, but also by the private health insurance, and it's not easy to deal with it. And we are not all experts in social rights. So as a community, we need to come together and advocate for a European action on rare disease, which brings together the different parts of the policy of the European Union in the field of rare disease, but also integrate more the member states and the European level into a cohesive, integrated approach based on goals, such as reducing the time of diagnosis, such as increasing survival, such as reducing the social and economic burden on families, or the number of treatments approved. These are our priorities, and we want also to ensure that Europe is a leader, a world leader in the field of rare diseases, both in terms of therapy development and research, but also in the model, in a European model of healthcare based on solidarity and on equity. By working together, we can bring this positive change in the life of people living with rare diseases, and that in the next 25 years, I hope we will have achieved results that we can be proud of, and even much more of the current results of today. I wish you a great event and a great moment together.